Hello everyone, welcome to the Rhythm Files episode 1. In this chapter, we'll discuss the basic parameters of the ECG and we'll also see the values. So, to know what an abnormal ECG is, we need to know what the normal parameters look like. So, let's take this case of a normal ECG and let's study the parameters. So, a 30-year-old patient came to the OPD for a routine checkup, and ECG of this patient showed the following findings. Now check out the P wave, the T wave and the QRS complex. Also watch out for any abnormalities in this case, any PR interval prolongation or QT prolongation. Make a mental note of the ECG report that you will write in the case file. So in this section, I have included certain parameters and their normal values because these will help differentiate between an abnormal ECG and a normal ECG. So first is the P wave that indicates atrial depolarization. It is usually inverted in AVR and biphasic in V1. The PR interval indicates AV nodal delay and is drawn from the start of P to the start of Q. The RR interval is the distance between the two R peaks and corresponds to the regularity and the heart rate. QRS interval indicates septal and ventricular depolarization and is usually less than 3 small squares. The QT interval indicates the total time of ventricular activity and is drawn from the start of Q to the end of T. Now, because it varies with HR, that is the heart rate, it is corrected against the root of the RR interval. Lastly, the T wave indicates ventricular relaxation and lasts for about 4 to 5 small squares. Next, we move on to the QRS axis. So this diagram, now here, the QRS axis is the resultant vector by plotting lead 1 and lead AVF in the X and the Y axis respectively. So if we see in the first ECG, it is a normal axis that is between -30 to +90. The second one is the right axis deviation. The third one is the extreme axis deviation and the last one is the left axis deviation. Now this table basically summarizes the previous diagram. I have also added a row for lead 2 to determine whether it is a normal but leftward axis or a true left axis deviation. So these things are important to differentiate between a normal, a near normal and a truly pathological ECG. So the pointers that I have mentioned here are based on the standard reference medicine textbooks. And as a resident, I feel that whenever we are given a call for an ECG report, instead of simply writing NSR, we should include at least some of the parameters that have been mentioned here. Now below is the standard example of how an ECG should be spoken about. Thank you. Please like and follow.